for the future, to improve the access for the people. It's our goal to work every day to see more people receive a treatment, more people receive malaria intervention. And with digitalization, we can do that.
My name is Jojo Mehra. I'm the Chief Product Officer at eGov Foundation. I lead the products function over here where we work across different domains, starting from health to sanitation to public finance management and the urban side of things.
I'm Neeta Tyagi, Director Partnerships at eGov Foundation, and I focus primarily on health. And the projects that we are doing is really sort of focused on the global south and African continent.
My name is Baltazar Candrinho. I am a medical doctor by profession. I am a National Malaria Control Program Director in the Ministry of Health in Mozambique. As a NMCP Program Director, I am dealing with all malaria control and elimination activities in Mozambique at central, provincial, district level.
So DIGIT is an acronym and stands for Digital Infrastructure for Governance and Inclusive Transformation. So it's basically an open source platform with reusable building blocks and shared data registries that can be used to build multiple solutions in different sectors, largely to deliver transparent and inclusive public services.
Despite digitization, I think they were not able to get the effectiveness out of every dollar that they were putting into the campaigns. And the reasons were really, siloed approaches, which is very common.
2020, we as NMCP, we make a decision to moving around for digitalization for the campaigns. So we in 2022, we started to digitalization of the campaign. It was LLIN mass campaign, and we use all the digital tools. So the experience, apart from some challenge for the initial, the experience was quite good, and we felt very encouraged to moving forward. And we moved to another province, and on that time we use the DHIS2 tools. And on DHIS2, we saw some limitation, particularly in terms of data geo-records and some additional tasks, like for example, how can we monitoring the payments, how can we monitoring the transports, and we ask we see some limitation on the platform that we used, and we try to looking around and find some platform that can fit this, because our vision, long-term vision, wasn't just to stop to pause in the mass campaign LLIN, but moving to another campaigns. And we as a malaria, we run LLINs, we run IRS, we run SMC campaigns. So instead of to have a different platforms for different campaigns, so we said, no, let's find out some platform that can feed all campaigns and also can give us some geo-record that we can use for another campaigns. And we call Salama in Mozambique. And we said, let's pilot and let's see how it's performed. And we did it, so now we are here.
If you look at the digital public infrastructure, one of the key elements of DPI are actually scale. and interoperability, the distribution of capability to solve. It is relevant for any campaign that is run across any, whether it is malaria, whether it is polio, whether it is tuberculosis, HIV, etc.
For example, we needed to build a new registry on households and we needed to build a new registry on individuals, but we build it once. So that tomorrow, when you're moving from a bednet campaign and you're moving from a bednet campaign, say, to an SMC campaign, or you're moving from malaria to polio or entities, you're reusing a lot of these building blocks and common data registries, right? And that makes your job of launching, running campaigns, setting up a lot quicker and a lot more cost effective, right? So a way to think about is saying, if you're going from one use case for malaria to another use case, you are literally spending one third the effort and time and cost in launching for a new use case, or even for a new country, right? So you launch it once in one country, and the amount of effort that you would spend addressing a very similar use case in another country would be a fraction of it. So when we design any product, right, we're designing it so that it can work in multiple geographies for multiple use cases. Now, when a country picks it up, let's say a country wants to use a certain product, let's say wants to use HCM, they would want to localize it in their context. And localization has several aspects to it. The first, of course, is language itself. Like, can you have it in multiple languages, and how easy or difficult is that? Then they've got certain contexts that they want to go and set up. Say, for example, they've got certain standard processes that they run in the way they run their campaigns, right? And how easy or difficult is it to make your product work with those processes, or conversely change the processes to work with the product, right? The things that they look at are what information is captured. Can you go and set up different workflows? Can I get certain amount of data that will help me monitor the program in runtime? And how easy or difficult is to set this up. So these are the things that they look at while localizing. The idea over here is that this process of going from a generic product to a localized version in the country should be really short. And this is what HCM, because it's built, it's highly configurable, it's built on common building blocks. One of them is saying, hey, can the data that's captured in HCM work with a national instance of a health management information system? This is what was done in Mozambique, for example, where they took the data that was captured for the campaigns in HCM and made sure that it works with the instance that they have of DHIS2, right? So that's one. The other thing that we're exploring is saying all the data that's captured for inventory, that's your logistic management information systems. Now, this is something that we're working with the Global Fund, a couple of private sector players over there who run these LMI systems, and saying, can we have an interoperable approach where when you're looking at any sort of inventory data, right, it works hand in hand with the supply chain data as well. So at any point in time, there is no discrepancy between what the supply chain dashboard is saying and what the actual inventory on the ground, as captured in a system like HCM, is reflecting. And this is something that we are seeing. Once you capture data at source, it starts affecting and starts, in fact, amplifying the impact of multiple different applications and systems within the space itself. So for HCM, after we had, one of the ways that we start getting information and knowledge about what are the key challenges as framed by experts on the field, and these are our practitioners, these are people who run campaigns, these are our governments who are responsible for public health in their countries. We try and absorb a lot of that and understand the challenges in a manner that they framed. The team basically spent about 75 days to 100 days on the field in Mozambique, shadowing multiple campaigns, working with health workers, going out on the field, and at each stage getting very quick feedback, doing multiple iterations of saying, is this something that is actually going to help that specific actor do their job better, right? Is this going to aid them? The overwhelming feedback that we got immediately after the first campaign as well, saying that, hey, this is easy to use. This is something that's actually helping me in my work, right? And this is something that we value in the design of the product itself. Because if you can't get adoption of users, you won't get adoption of the overall DPI itself. We follow a human-centric approach at eGov in the design of our products. And by that, we essentially mean, is the product actually helping solve the needs of people who are going to be using it in their context, right? And that's very simply how we do it, right? At each point in time, whenever we're designing, let's say, an interface, or you're working towards a certain output, are you keeping the actor right at the center, saying how will that frontline worker benefit, and is this actually going to solve their problem of doing their job using HCM in this case, right? So this could be small things like recording data, right? Saying that, hey, I'm actually going and capturing information about households and individuals. Can I just make that process easy? Can I make it easy to retrieve data? But in each country that we go to, we do a lot of training. There's something set up over at eGov called Digit Academy that looks at training people, right? So it looks at training the master trainers who would then go and train their workforce as well. So we work with them, saying in designing these kind of trainings as well. But before the system goes live, we do a system usability score, so that we are getting a qualitative feedback saying, hey, if this is something that they're going to be using, are they happy using it or not? And they basically rate the entire application as well.
Yes, for example, for mass campaign, for Alliance net campaign, for that, this campaign will go door by door, and we distribute the nets. And this campaign, we use a lot of warehouse to store the nets. We use the trucks, the cars to go for all these places. And we use a huge amount of people. We pay some subsidy for this campaign. And for IRS, we use the different, actually we use the Excel spreadsheet and something different. People go to the IRS is the indoor residual spraying. We go to every house and we spray in each house. When we go to some house, we ask one people in the house and how many people lives there, and we have to remove the goods into the house, go there and spray. So it's a different level of efforts. We not use all this warehouse, but we have people to go every day, and they spend a lot of efforts there. For the seasonal malaria chemo prevention, SMC, we distribute the drugs. It's a different one was the nets, another one is the insecticide, and the other is a drug. Pills is a different. We go door by door and distribute pills and stay there for them to took the first dose direct observation. After that, we give them pills to took on the second and third days, and they make some registration. So the way how can we register these three campaigns is quite different. If we see is that we can think, okay, maybe we need the three platform different because we collect the different forms. One, we go to one house and distribute the nets for everyone. Another one, we go to one house and spray in the house, so just ask how many people live there. And the drugs, we have to go and give them the pills and stay there to control. And also we need to report some adverse effects. Of course, if you see those three, we said, okay, we need a three platform. But if we have a three platforms for three campaigns, it's gonna be quite difficult for us to manage. So that means that even the IT team, the technical team, can dealing with different problems, different issues for different platforms. So we feel that it's much easier to have one platform. If we have a one platform, we know everything about the platform. We know the challenges, we know the issues, we know how people can manage. What we need to do is just to work on the forms, okay, and dashboards and the way the campaign is implemented is different. Maybe one campaign we use 10 forms, another one 5 forms, or 2 forms. But the way out the data flow can be the same. The other advantage is just to have a same to have all this data. We collect the information as real-time data. So the time that teams are in the field works, everyone can have access. Everyone can see the data, can see, okay, the campaign started. At the end of the day, we can see even the performance of the team. We can see, okay, the team 1 has low performance, so we can increase or training or force. And then we see the coverage. The coverage, so okay, it's 90, 80. We need to go to go back for this area, or it was completed, or we exceed 100% as we plan it. Maybe there's more people. What's going on? Then we can go there to investigate. And we have this geolocation. If we have a geolocation, georecord, we can go, for example, one campaign. We do mass campaign, for example, and we have the geolocation. And then we have to go there and do the chemo prevention campaign to give the pills. We can use the same data and say, look, those are the areas, how many houses we have. We can map and say, okay, it's make easier our planning for the campaign. Said, okay, maybe now we know that there is 1,000 houses, and we can planning better and go there. So that's some advantage to have a one platform. The team, if the team knows, the help desk is quite more familiar with the platform, they can give support for the different teams. And based on the experience in one campaign from other campaign, they can improve. Okay, one campaign to another campaign, and become more strong.
Right, say we've done an enumeration, right? We've built out a registry of households in a particular geography, let's say in a particular state. Can that data now be reused for another type of campaign, right? So if I've done, let's say, a bednet campaign that captures household data, can the same data now be used to do an IRS campaign, which also needs household data in the same registry? Now, what you've done is that you've actually transformed your program, where you're saying, instead of everyone going out there and enumerating the same piece of data again, can they look at enriching it, right? So it's quicker, it's cheaper, and as a result, you can reuse that money for extending your coverage, or procuring, let's say, more medicines or more bed nets, etc. Right? So that's one part of it. The second part of it is reusing your building blocks of the application itself. One of the ways that Mozambique is, for example, looking at extending this, and I gave a quick example of saying how they wanted to kind of stitch in a complaints handling module capability and have a centralized complaints help desk. Now what they're looking at is saying, hey, can this actually be extended to include things like attendance and payments, right? Because Digit has these core building blocks, they're looking at now extending attendance and payments to frontline workers happening through Digit and Digit HCM itself.
Technology cannot be an answer to a weak leadership, because end of the day, technology is just an enabler. Standard operating procedures is the key one, because if people do not follow those standards, it is very difficult for any technology to be successful. Dr. Condrino is definitely the champion for adoption of Salama.
So one of the things that that I think is key is the presence of a champion, right? Of a local champion who's saying, I want to take a particular approach to solving my societal problems, right? So whether it's in the public health space, whether it is in the sanitation space, public finance management, etc., right? So identifying those champions and that champion really saying this is what I want to do is important. Then I think it's looking at digital technology itself as more than a tool, right? It's basically saying, do you understand that a lot of these problems are interconnected, they are interrelated? Can you set up, almost take an infrastructural approach where you're solving for a specific use case. You always start with a specific use case, but in the way that you solve it, you're clear. Your long term vision really is to be able to bring about a transformative change. Our approach has been to work with local partners, pass on the agency to them. That means that you're also reducing the tech dependency. We're simplifying the platform. That's one thing that we're working towards. The other really is distributing this ability to solve, right? And that is our at the core of our approach as well, saying how do we do things in a manner, what do we need to do so that others now can solve many of those problems, and it's taking eGov out of the equation. One of the big challenges in health campaigns is understanding what is referred to as coverage data, right? Saying that, do I know where my population is? And now, if your digital system can make that job a little more precise, a little more easier, chances are that you will increase your coverage, right? If I can make the job of knowing, for example, when my stocks are going to run out, right? Saying your information is captured in a certain way, whether it's bed nets or medicines, let's say in this case, bed nets, and bed nets need to move from the national warehouse to the district warehouse to the administrative post down to the village to the beneficiary's house. How do I know that at each level I have enough stocks for the campaign to run effectively so that the next day the bed nets can be delivered on time to the intended beneficiary? Using this approach, what we're able to do is saying, if I can provide a small alert to someone saying, at your current rate, you're going to run out of your bed nets in the next 3 days, please stock up, right? It's a very small, simple intervention. It has a huge programmatic outcome, right? And this is something that this approach really helps, saying that you've thought about what the needs of the program manager or the warehouse manager is, and that is what they're trying to solve for. They're trying to solve for saying, am I stocked adequately to be able to go and do my job so that the bed nets are delivered on time to the intended beneficiary, right? So this is, I'm just trying to draw that link between how you think about design and how you think about outcomes, and that entire chain. So one of the benefits of taking a DPI approach really is reuse of what is being done. And there's reuse in data and there's reuse of digital assets.
I would say it needs a very strong ecosystem of partners, not just from the domain perspective, but also how to operate within a country. Mozambique is Portuguese speaking. So this is something, a skill set not easy for eGov to have. And, and that's where our partners who can speak the language, who know the bureaucrats, something that we realized very early on, that if you do everything yourself, then you yourself become a bottleneck. So it's important to have a set of partners who can actually take it. So the situation today is that after analysis, after comparison of other tools that Mozambique and MCP had used, they have reached the conclusion that they are going to use Digit HCM for across all malaria campaigns, across all provinces, for Mozambique to kind of put that kind of confidence and trust. And the whole world is watching them. I think people are talking to them. They are asking them how it went, what are their next steps.
Some efficiency in terms of if we receive data in real time, we can make a decision in real time also. If we see our dashboard, and we can the performance of the team, it's very important for us to see the team 1 or team 3 or team 5 needs support. For the supervisor, they can't go to see everyone, but we can focus and say, look, go first to see the team number 3, and then you can go for team number 2, and the last is the team number 1, because team number 3 needs more support. And if we go there and give some training for the team number 3, and we can see on the following day they improved, and then we can say, okay, now team number 3 to 1 is much better. Let's see the another team and focus on that. So this can bring more efficient on the campaign. One is to bring the digitalization is not one thing that someone came and say to me that, look, I have this, let's do that. It was our dream first. We said, let's do that. Okay, it was at the beginning. We said, let's move to the digitalization. And we had it in our strategic plan. So we do believe. Personally, I believe. And I spoke with my team. I said, this is the way that we want to achieve. And initially, my team said, feel very afraid. And they said, no, maybe continuous dream a lot because we can't do that. I said, we can do that. They said, no, it's very difficult because we don't have internet, we don't have a connections. How can we manage the device? All the challenge at the beginning. I said, no, we can do that. Let's try and you will see the results. First is belief. The second was to build the team. After that, said, okay, if we believe in that and we say that this is the way that we want to go, what is the people, the team that can work on that to bring the relevant team internally in the NMCP and other departments in the Ministry of Health, and also the partners, the rights partners to come on board. If all these people comes and works with you, now you move to the 3. It's a leadership and the coordination. So you have a lot of efforts to have a meetings, coordination meetings, and to engage them, to explain, and to and then you have to convince them that it's a learning process. They will increase their capacity. It's an opportunity for them to growing up in terms of knowledge, to understand the process. And at the time that the team are very engaged and see that this is an opportunity for all of us, so they try to understand more. I would say that from the perspective in the government, sometimes it's much easier to leave the partners to do everything, because this make a lot of efforts. I said, why I have to do weekly meetings twice a week or every 2 weeks, and meetings a lot of and follow this? Let's give us some partners to do everything. Teach us how can do that. And I would say that my teams, they work a lot. Even the other departments in the Ministry of Health, the technology and in the communication department, we engage them, and those technicians was very. I remember that at the beginning, the eGov team, they said, no, they are not well engaged, they are not working, the skills is not enough to deal with this. I said, look, it's a beginning. They never do that. What they do is just to manage the process that was already done. And this process was different. We started to build the platform together. And it's normal for them to don't understand, to don't have any idea. So let's take some people from there and engage them and keep works with them until, so you will see. And what I see is they improved. So they need to improve more because they don't have it's a process, learning process, but I would say that they improve. So it's a combination of leadership, it's combination of coordination, leadership, engagement, partnership, okay, and capacity building. It's important to give some name that is familiar. So Salama is Swahili, is like a African language. Is not like a proper Mozambique language, but is familiar because in some areas of Mozambique we speak Swahili. And when you say Salama is friendly name, yeah? That's meaning is friend. Is so we know. So when the time that we see, okay, now the name is Salama, you know that name is like a brand on this, on the malaria, on the health, on the everything, everywhere. The brand has some importance. If you, like some companies, we know that. And Salama said, okay, it's our brand, it's our name. We start with this name, so the people feel more happy and confident. Time that we have opportunity to disseminate, to tell our story, and they feel interesting and ask me to go and talk about that, and to on the view, on not on just on the malaria view, but on the view to engage the Minister of Health. I think that's a good step for to move into another department. And I would say that malaria is a good experience in terms of digital platform, particularly in terms of ownership, uh, engagement and ownership. So there is a potential to do that. Um, and I think one day we'll reach. Yeah, this is a part of our goal to see the other departments, other programs, and we don't need to rush, but we'll achieve step by step. On the campaign, it's very useful to see the coverage, to improve the performance, to monitoring the supervision, even if we say that nets, if we achieve more people and we can monitoring the campaign and we can achieve more people, the results at the end of campaign is protect more people. If we protect more people, so we can see the impact on malaria. The impact can be on malaria mortality or in cases. So I would say that if the campaign is performing very well, so we see the results at the end that the case is going down. Depends on the type of campaign. For net campaign, we'll see the reduction in cases. For the chemo prevention, we see the reduction in the severe cases and the deaths because of we can on real-time monitoring we can reach more people. It's require some efforts at the beginning, but these efforts we can see the results after implementation of the campaign, or depends on the type of campaign. So you can't give up or to say that it's like there is some challenge on the process. It's not like everything run very well. There's some challenge with connection, with synchronization, with device, with training, with people selected. It's with software. It's a process at the beginning. But if you continue and you persist on that, you will see that all these challenge can easily manage by the team because of they will know even for the community workers, they can understand how they manage. The time that you build, you continue, you persist, you solve the problems, you will see that the percentage of problems we can start. So that's one. Second is the partnership is very important. Yeah, and to see the mapping, the partners that can bring additional support, and identify the right people, and involve the government at the beginning, involve the other sectors at the beginning, put them to work, engage them. I think that can work. One thing that it's important for all of us to understand, if it's not like 100% perfect, there is some potential to change. So we know that the Salama team, they are willing to change. They are willing to understand, to receive our feedback, because we are the users. And we say that no, this dashboard is not well presented. So they are very willing to change. Said, look, this is not, you're not people in the field, we're not happy with this graph. Let's change. So let's go for this approach, and they are willing to change. So this is a partnership and hopes and goals. So I think that's it's something that there's a potential for the future, for malaria, to improve our coverage, to improve the access for the people. It's our goal to work every day to see more people receive a treatment, more people receive malaria intervention. And with digitalization, we can do that.